patient may suffer diarrhea. So he is also having diarrhea. Okay? And I forgot what are the other symptoms he told me. Let's see, I have written there. What are the other symptoms he told? He is having headache also. Loss of appetite there. Heartburn is there. And dragging pain at the site. Something, I feel something there, he said. Okay, so it is one of the important things. And soreness of tongue, apathy. He is unable to concentrate in something, in any work. He often suffers depression. Okay, so these are some problems, and for last 5 years is suffering. My patient is suffering from this, and he reported weight loss during the period. So these are the complications, and our doctor. What is there? Okay, let's see. Physical examination. So now he will be examining physically. One out of track. One ECE we will be conducting really through role playing. You will be acting as patient party, and you will be also acting as doctor. You will go to another doctor for investigations, and they will give you the investigation reports, and you will say, one person will tell, these are the investigation reports, and the doctor will then identify or diagnose the case. So you will be doing it. Okay, so this is how this is done actually in reality. So you will be assessing. We will be training you up for that. So after examination, what you observe, his weight is 60 kg, and according to his height, the weight is less. He is underweight. Means malnourished. Okay, he is underweight. I will not say malnourished. Yes, it can be said. He is malnourished. Okay, why it is malnourished? If I don't explain it, and you will be asking me, sir, you said it is a malnourished patient, but why? Okay, on examination, we felt that the spleen is enlarged. Spleen is enlarged. So, enlarged spleen, when a spleen enlarges, what are the functions of spleen? Spleen, it is a lymphatic organ, isn't it? It is a lymphatic organ, and its main purpose to provide you protection. See, a lot of cells are dying. So where these cells will go? Dead cells will go. When the blood will be passing through, they will trap the wound cells, abnormal cells, antigens. Okay, so these things will be trapped by the spleen, and they will process it, metabolize it. And they produce lot of lymphocytes. And these lymphocytes, they some act as antibodies, and some produce antibodies. There are two types of lymphocytes, B lymphocytes, T lymphocytes. Okay, T lymphocytes, there are killer cells, NK cells, natural killer cells. They actually fight against cancer cells. Okay, so a lot of functions are actually done by the spleen. When the spleen enlarges, it means its activity is increased. When activity of some organ is increased, activity of my bicep is increasing, and day after day I am doing it, regular fashion. What will happen to my bicep? This is hypertrophy. And atrophy means just opposite. Atrophy means just opposite. If I am unable to walk because of, say, leg injury, so there is bandage on my leg, so I will be unable to walk. So what will happen to my muscles? Gradually muscles will become thin. And when this bandage is removed, plaster is removed, you will find one leg is okay, another leg is thin. It's because of atrophy of the muscles. So inactivity leads to atrophy, and hyperactivity leads to enlargement. So by splenomegaly, so its activity, when I saw by investigation, physical examination, the spleen is enlarged. Okay, so it means its activity is increased for some reason. Maybe for the disease by which he is suffering. It may be the cause. Maybe associated with this. We have to link it. Why there is splenomegaly? Okay, so another is pale skin. Paler here also. Skin is pale, so pale skin indicates low hemoglobin content. Okay, so these are the signs in physical examination. I saw, and also the uncontrolled gait is also there. So, to make a diagnosis, what has actually happened, I thought advising for some tests has to be done. So what is there? Because of what is the cause of paleness? So there may be some hematological indices may be changed. So I advise CBC, complete blood count. Means RBC count, WBC count, platelet count, and different indices, MCB, MCH, MCHC indices. And there I also advised for peripheral blood smear. Whether there is abnormal, we do it because of to identify whether there are abnormal cells. So for that purpose, I have also advised peripheral blood smear. Then reticulocyte count. In the other class, we know when reticulocyte count is, normally it is 1% of total RBC, and it may go up to 4%, 5% when there is increased activity in the bone marrow. So that's why reticulocyte count is given. So if I get any abnormality there, and then I suggested bone marrow biopsy. I found some report came, what are the reports? So I found some difficulties in CVC and peripheral blood smear, reticulocyte. So I thought then, okay, there is actually the main site, that is bone marrow, there may be some problem. So are there any any problem in the bone marrow? So that's why I have suggested bone marrow biopsy. So it is taken. It is taken. What I will find, what else I will see later. What is the size of the RBCs, growing RBCs there? Are there any WBCs, platelets there? If its amount is more, if there is any, only most of the RBCs which are developing within the bone marrow are abnormal in size or mostly increased size, means their development is poor. Their development is poor means their size is, they are not regressing. They are not regressing to normal size. And we know size is gradually decreased to 7.2 micron. And most of the cells are in bone marrow biopsy, in bone marrow smear, we find there are most of the cells are nucleated and bigger in size. And almost all the area is occupied by the RBC progenitors. There is no, only 30% of space is occupied by 40, 60, 70% cells are, space is occupied by RBC progenitors or of RBCs of different developmental stage. Whereas for WBC there is little space, only 30% space. So there is some problem in the bone marrow. Okay. So then what I did this test. Blood levels of vitamin B12 and folic acid. We know deficiency of these two nutrients. These are nutrients, no? Inadequate supply of nutrient is also malnutrition. The patient is, that's why malnutrited. Means my patient will show low level of blood vitamin B12. Means in my blood there is less vitamin B12, but folic acid is normal. So not because of folic acid deficiency, in my blood there is deficiency of vitamin B12. What will be the result of vitamin B12 deficiency? What will be the consequence? What will be the consequence? There will be decreased production of DNA because they are actually involved, these two vitamins are actually involved in DNA biosynthesis in the bone marrow. So if DNA is not properly synthesized, how cell division will be made? How the nucleus will divide? We need the material. Okay, so nuclear material is DNA, RNA. So for production of DNA, vitamin B12 is essential. Since vitamin B12 is less, so there should be decreased production of number of cells. It may be WBC, it may be RBC, and my CBC result says there is decreased number of RBC. Instead of 4 million, 5 million, there is 1 million. Came down to 1 million. Since RBC count is less, then my hemoglobin amount will also be less. Because this RBC will contain hemoglobin. That's why my hemoglobin also came down to 10. Below normal level. Below normal level means I am anemic. The patient is anemic. What is the cause of anemia? Why? The cause of anemia. Cause of vitamin, I found there is vitamin, in blood there is less vitamin. Okay. That means I am eating, the patient is eating less vitamin B12. When I observe, no, he is getting all vitamin B12 rich foods. He should not suffer from this. He is having, he is eating vitamin B12 rich food, but his blood is not having proper amount of vitamin B12. What is the reason? Immediately, I think, these are not absorbed properly. There is absorption problem. And we know. So what Maybe the cause of lack of absorption. Is ready to answer. Okay, tell.
It may be wrong, but I think that his gut bacteria are not functioning properly, or he has no good gut bacteria.
No.
No good gut bacteria.
You are thinking about, think upper. Think about upper part. Huh? Very good. Excellent. Excellent. One or two girls responded, I am successful. At least somebody could collect information from me from my lecture. We repeatedly told for vitamin B12 is required for vitamin B12 absorption. One important thing is required, that is intrinsic factor, gastric intrinsic factor. It is responsible for absorption of vitamin B12, and these are produced by, I'll show where these are produced. By parietal cells of gastric gland, by parietal cells. And these parietal cells not only secrete intrinsic factor, they also secrete hydrochloric acid. If the cells, parietal cells, are destroyed by any means, important, by any means, if these cells are destroyed, what will happen? I will not be able to produce hydrochloric acid. I will not be able to activate pepsinogen into pepsin. So there will be inappropriate, improper digestion of proteins. You are eating flesh, egg, fish. So these proteins will be initially digested by pepsin. Actually, this is secreted as pepsinogen. Now, pepsinogen is inactive. It has to be converted into active form. And who will do it? Hydrochloric acid. And once this is activated, this pepsinogen, active pepsin will activate its own proenzyme, means pepsinogen. Initially, it has to be activated by hydrochloric acid. Once it is activated, pepsin is formed. This pepsin will act on pepsinogen, and in this way, the cycle will go on. Activation of pepsinogen into pepsin, and so protein will be digested, partly, not wholly. The big molecule of pepsin will be splitted, lot of peptide bonds will be there, formation, and they will, when they will be leaving stomach to enter into the later part, there it will be digested by pancreatic juice and also by the intestinal juice. We will study. When we will be studying GI tract, then we will study in detail. So, if parietal cells are by any means destroyed, then what will happen? I will not produce sufficient hydrochloric acid and sufficient intrinsic factor. Because of lack of intrinsic factor, there will be no absorption of vitamin B12. Since vitamin B12 is not absorbed properly, blood levels of vitamin B12 will fall. It is not absorbed. So in blood there will be less deficiency, and this will cause less production of DNA in the bone marrow, less blood cell productions, less WBC count, less platelets count, less erythrocyte count, less hemoglobin. Clear? Now, In absence of hydrochloric acid, there is a condition called achlorhydria. Achlorhydria. What is achlorhydria? Then what is achlorhydria? Less production of hydrochloric acid. Less acid formation in stomach. This is called achlorhydria. So because of achlorhydria, there will be what? Indigestion of protein, because proteins are digested by the pepsin. Pepsinin is activated from pepsinogen, and hydrochloric acid actually converts pepsinogen into active pepsin. So this function will be deranged. So if something is not absorbed properly, digested properly, what you will feel? Nausea. Vomiting will be there. So it is because of that only. The patient is having nausea, vomiting. This is the physiology. Actually, all the complications we have to explain in the true physiology. What is the basis of physiology? You have to understand that. Because question will be there. You explain why it has happened. It has happened. Upper GI endoscopy with biopsy. What I did? Endoscope is sent to my stomach. Everything, what is there inside, at the inner surface of the stomach, I will be observing there. So I find the wall of the stomach is some part, major part of the stomach is plain, smooth. Means there is no gland. There is no gland. We call it atrophied gastric mucosa. Atrophied gastric mucosa. So since there is atrophied gastric mucosa, it means that when GI report comes, we find the endoscopist in his report he said some parts or a significant part of wall is atrophied. Immediately it's atrophied means the glands are not there. No glands. These are atrophied. So they are not producing, they are not having parietal glands. They are not having oxyntic cells. Some other cells they are not having. They are not secreting mucin. That's why it has become, because of the glands became atrophied. Okay? So, when I got the report, now this may become atrophied. Why it has become atrophied? Again question came to me. Why it has become, what are the reasons? Remember, there may be two reasons. You might have heard a bacteria that may cause it, that is H. pylori. H. pylori infection, and that may destroy the gastric glands. And when these are destroyed, so a lot of consequences will be there. So this is one reason. My endoscopist, he said, so no, I have tested, when I taken the sample, biopsy sample, some mucosa, and I tested for whether there is any H. pylori, some kit is there, so it is negative. Means no H. pylori infection is there. So it is not the H. pylori for which this has been done. Atrophy of the gastric mucosa is done. Then who did it? Who is this person? Ari? You yourself, the patient itself, he may be destroying He himself, not any outsider, not any bacteria, but he himself may be destroying his cells. We call such diseases as autoimmune disease. So, because of autoimmune disease, there may be death of these cells. And what are these? Our body produces antibodies. And these antibodies are normally not made, but during this sort of disease, autoimmune disease, our body produces such antibodies which can destroy the parietal cells. So these are called parietal cell antibody. So immediately I look for in my blood whether there is any anti-parietal cell antibody. Okay? It may remain normal parietal cells, and it may produce intrinsic factor. Hello? It may produce intrinsic factor. But somebody is not allowing this intrinsic factor to bind with vitamin B12. It is again another antibody who binds with intrinsic factor and inhibits its binding with vitamin B12. This may be also the cause. It is also a autoimmune disease. Clear? So, in this case, his H. pylori is negative, but presence of these two antibodies we got in the blood. So, immediately we could able to diagnose my patient is actually suffering from pernicious anemia, vitamin B12 deficiency anemia, blood less vitamin B12, and at the same time the absorption he is eating lot of vitamin B12, but he is unable to absorb it because of lack of intrinsic factor. Because these are inhibited, these are by antigen and antibody reaction, intrinsic factor is unable to work, and the parietal cell also damaged by these antibodies. Okay? So this is anti-intrinsic factor antibody. H. pylori I got negative. Upper GI endoscopy, what was the result? Hyperatrophy of the gastric mucosa. H. pylori is negative. Blood levels, folic acid normal. Serum bilirubin, his urine is yellowish. His urine is yellow. That means there are more urobilinogen. Means my blood is having bilirubin. Since yellow is yellowish, and the eyes and the sclera is also slightly yellowish, that means the patient might have high level of bilirubin. So immediately I checked his bilirubin. I found yes, his bilirubin is not normal. So there is some jaundice. Why this has happened? I mean, we know where from it comes. Bilirubin, it comes from actually destruction of RBC. When RBC is destructed, killed, it releases hemoglobin and produces heme and globin, and this heme is further metabolized into bilirubin. These are normally secreted through bile. And it passes through the stool. So when I saw there is bilirubin content is high in blood as well as in the urine presence of urobilin, immediately I thought there is destruction of RBC. And what is the cause of destruction? The RBC that are formed that are not properly matured. These are actually immature. And these immature blood vessels cannot survive 120 days. So, abnormal RBCs, abnormal in size, increase in size, they cannot survive for their longevity will be less. They easily have, before that they will become agile. So agile means something else. They will be, they will become senile. Means their age is increased. Actually, they are not aged. They are actually since they are immature, their lifespan is decreased. So after a few days only, they are going to die. So these cells are trapped by spleen. So activity spleen is increased because of this. So it is producing, distracting the RBC. So this is the cause of hemolysis. This is the cause of breakdown of RBC. As a result, urobilinogen is we are getting and bilirubin we are getting. Understood? Because of activity of the spleen. It has increased. Size of the spleen has been increased. Iron panel. The proteins carrying iron from intestine to liver, and from liver, the proteins that are carrying from liver to bone marrows, whether those carrier proteins are available or not, whether the amount of iron in the blood is present. So I assess this through iron. If it is less, then I will suggest this is iron deficiency anemia. But there everything is okay, so there is no iron deficiency anemia. So it is not because of iron. Clear? So these are the investigation, and what are my findings? RBC. The morphology of RBC. What? Macrocytic, normochromic. Size of the RBC is increased. Normally it is 7.2 micrometer, but it is become 8 point something. So size has been increased. And at the same time, hemoglobin also increased. But the number is decreased. As a whole, count is decreased and hemoglobin level also increased. But when you consider a cell, the cell, though its size is increased, the content of RBC, hemoglobin is normal. Normal means according to the size, it is normal. That's why my MCB raised, MCS raised because of simultaneously increase in mean corpuscular hemoglobin, mean content of hemoglobin in each cell. This is also raised by 50 picogram, and normally it is 28 to 32. Size of the RBCs, mean corpuscular volume, size of each RBC is increased from upper limit is 94, but it is more than 95. So size is a, that's why you call it macrocytic. And since in relation to the cell, though it is normal, that's why it is normochromic. And then hemoglobin less 9 gram %, RBC dia increased 8.2 micron, and what? RBC dia, MCB, MCAC normal. Peripheral blood smear shows nucleated RBC. So there should be only 1% of RBC is reticulocyte, but there is no nucleus. Normally you won't find any nucleated RBC, but in suspension, in the smear, I will get nucleated RBC. This means these are all immature. before even conversion to reticulocyte, this came into circulation before their maturity. And poikilocytosis, abnormal shape. Abnormal are taking us. Anisocytosis means cells are not of equal size, variable sizes. So you may smear, you may get anisocytosis, also poikilocytosis. RBC, as I said, RBC will be decreased and platelet count will also, there will be less production since bone marrow is affected. So less production of platelets will be there, as well as my spleen. It's normally, what happens, it always stores some platelets. When there is emergency, for example, bleeding or hemorrhage, then immediately spleen undergoes contraction and these platelets are released into circulation. So here, since size is increased, so they will be trapping more platelets. As a result, the count of platelets will be less in the. She will explain the cause of reduction of platelets. What are the causes in this case, in this condition? What is the physiology? Anybody? Raise your hand. Two reasons. Decreased production by the bone marrow because of lack of vitamin B12 supply, lack of DNA production. So when there is lack of DNA production, so biosynthesis also, platelets will also be affected. Megakaryocytes will not be formed in adequate number. So from megakaryocytes, platelets are formed. So this is one reason. Another reason is, since spleen has increased in size, it will trap platelets from the cell, from the blood. So as a result, blood count of this will be decreasing. Cause of reduction of platelet count in this patient. You see, I told her, there are two reasons. You tell the reasons.
The vitamin B12 is less, so platelets.
What is less?
Vitamin.
Sir, if vitamin B12 deficiency is there in the body, then vitamin B12 actually, the DNA, part of DNA that codes for RBC production. The vitamin B12 is required for that DNA, for the DNA manufacture. So the RBC production decreases and the bone marrow, the red bone marrow production also decreases. And the spleen, if it is increased in size,
their activity is increased. They will be trapping more platelets.
They trap more platelets
And since vitamin B12 deficiency is there will be less production of WBC. DNA. And DNA is required for cell divisions. So if, because of lack of or reduced cell division, so production of RBC will be less, WBC will be less, platelets will also be less. That's the reason.
There are two causes for platelet decrease. First of all, the DNA. There's for the first reason is the spleen is enlarged, due to which the platelet has been captured in it, and for that the amount of platelet has been decreased.
Next,
it alters the DNA, so the cell division has affected, and so no new platelets can be formed, and the platelets are already trapped.
Number of platelets will be less. Reduced production of platelets there will be.
There are two reasons for the decrease of platelets. First is the lack of vitamin B12, which also further there is a lack of cell division due to lack of vitamin B12.
It will lead to
lack of DNA
synthesis in the bone marrow,
which means it will
lack of cell division.
And the second reason is
Lack of cell division. It will affect synthesis of all blood cells. Production of all blood, so including platelets. So there will be reduction in platelets. Next.
Second reason is due to the enlargement of the spleen. There the platelets get captured. So
There will be reduction
there will be reduction.
in the number of platelets in the blood. Pernicious anemia. What is how we made the confirmation? Oh, how you diagnose this? It is the pernicious anemia. First, what are the cause of pernicious anemia? Vitamin B12 deficiency. He is eating more vitamin deficiency, but it is not entering. So, for which problem the patient is actually suffering from pernicious anemia? We have already seen. Huh? Look at that.
Is it because of the deficiency of platelets or reduced number of platelets? Because of vitamin deficiency of vitamin B12, there will be less manufacturing of DNA and reduced.
First of all, it is an anemia, na? So how you proved it? Through my physical signs symptoms and then through investigation. Anemia means RBC down, means decreased RBC and decreased treatment. So anyway it is confirmed. And it is vitamin B12 deficiency. How you confirmed it? Blood levels of vitamin B12 is less. And why this blood it is less? Eating more but not coming to blood. There is problem in absorption. Who is responsible for absorption? So either from where they are produced, they are not there. It is something wrong in there, in gastric glands. And if it is okay, then there is problem. The thing they are producing, that is intrinsic factor, that is not acting properly, means they are inhibited by my immune system. Okay, so that's why we came into decision that this is pernicious anemia. What is this for? To study whether anemia is there, visible anemia, we call it pallor. If pallor positive, if pallor is there, sign of pallor is there, that means anemia is there. Okay, there may be low hemoglobin, low RBC count. So this is what? Intestine. Huh? Is this intestine? What? Stomach. Okay, good. In the wall of the stomach, inner wall, there is gastric glands. These are the gastric, and they will contain various types of cells. These are mucus cells. These are mucus cells. They produce mucus. And this mucus, secreted by them, forms a coat, layer throughout the inner surface. This is absolutely needed. If it is removed in some spaces, then what will happen? These cells, green color cells, they produce hydrochloric acid. So this hydrochloric acid is coming to the lumen. Okay? These are acidic. And these cells, they are producing pepsinogen. And they will be activated by hydrochloric acid into pepsin. Now, if pepsin gets protein, it will digest protein. whether it is cooked or uncooked, no material. So if the mucus coat is removed, then what will happen? This pepsin will digest these cells. And below this there are capillaries. And ultimately they will also destroy the capillaries. As a result, there will be hemorrhage, bleeding in the stomach, within the lumen of the stomach. It happens in peptic ulcer. If ulceration is there, means what? The coat, mucus coat is removed. If you change your food habit or food practice or irregularity in, there will be irregularity in gastric secretions, and this may cause after prolonged, and if you do it for prolonged period means every day you are doing it, then that means you are insulting your stomach. And insulting your stomach, you are not maintaining any routine. Then this, when you insult your family member, what, they revolt one day? They will revolt, and you will face the consequence. So here also, the glands will revolt. The inner mucosa will revolt. There will be removal of mucus layer. It will be so, under the mucus, these cells are there, they will be exposed to pepsin and hydrochloric, they will be destroyed, and below this layer there are blood vessels, capillaries, they will also be destroyed, there will be bleeding. So when your stool will be black colored, it confirms that stomach, there is bleeding in the stomach. Melena. Black color stool actually happens in melena. Okay. That means if these cells are damaged, there will be no production of intrinsic factor and hydrochloric acid. If they are intact, but they are unable to function. Why? Because of antibody. In case of immune disease, they can damage, or not only, they can damage the function of bone marrow biopsy, smear. So here I find these are the abnormal, increased size megaloblast, macrocytes, having large nucleus. We know it should gradually shrink. Then in reticulocyte, there is no nucleus. But in such case, what happens? These nucleated RBCs are coming into circulation. So it happens only in such cases. See, endoscopy. These are atrophied area. These are the atrophied area. This is the atrophied area. Okay. Now, let us see the picture in pernicious anemia. What will happen to the blood picture? What are the things, if you, in hematology, when you will be performing hematological tests, then what are the changes you will be getting? First of all, about the RBC. What you will find? The size of RBC is increased. That's why it is called macrocytes. So, there is anemia. So, in case of there will be a microcyte. And the content of each, according to the size, the content of hemoglobin is normal. So normochromic. Per cell, chrome means color. When the cell is increased but not the hemoglobin quantity, then it is hypochromic. The cell is increasing in size but its hemoglobin content not increasing, then we will call it hypochromic. If size is increased at the same time hemoglobin also increased, then we will call normochromic. And if according to the size hemoglobin is less, we will call it hypochromic. Hypochromic and hyperchromic. But here the size is chromic, means it will signify the amount of hemoglobin present in each cell. Hypochromic means less hemoglobin in each cell. Normochromic means adequate hemoglobin in each cell. And hyperchromic means more hemoglobin as in respect of the cell size. Okay. Huh? Oh. So this is one. And what about the size? How much it increases? How much will be the size? Not 7.2. More than 8. More than 8. 8.2. It may be 9. And variable sizes. We have seen in blood smear there are RBCs of variable sizes, variable shape. Isn't it? So these are the findings we will get in peripheral blood smear. And we will get more reticulocytes. Normally it is 1% of RBC. Here we will get more than 4% of RBC. About 4% of RBC. So there will be reticulocytosis. We call it reticulocytosis. There will be reduction in WBC count. There will be reduction in platelets count. Okay? There will be net reduction in hemoglobin content. Okay? And what about MCAs, PCB? PCB means MCB, so not PCB. MCB, mean average. Mean means average. Corpuscular volume. Corpuscle volume. What will be there? Increased or decreased? Mean corpuscular volume. Volume of each RBC. Whether it will be increased or decreased. Increased. Because we already told, no, it is a macrocyte. So their volume will be increased. So macrocyte. So that's why MCV, mean corpuscular volume, will be increased more than normal. And MCS means mean corpuscular hemoglobin content. It will remain. It will also be increased. Sometimes increased, sometimes remains normal. Okay, MCSC remains normal. So this is about changes in RBC. And what happens in my GIT? Gastrointestinal tract. We have already told repeatedly, there may be atrophy. The parietal cells may not produce what? Factor, intrinsic factor, may not produce because these are atrophied. So this is the, as a result, vitamin B12 will not be absorbed, and in blood water will get less amount of hemoglobin, already told, vitamin B12, normal folic acid content, bilirubin high, in urine we will get bilirubin, and not bilirubin, urobilirubin, more than normal. So there is more excretion of bilirubin in the form of urobilinogen. So it is going to affect bone marrow. Okay. So it has already been discussed what are the effects we could the changes we see. And one more thing we have to explain. Why do we feel tingling? Why that? Why it is there? Important. Vitamin B12 deficiency causes demyelination of nerve fiber. Anybody, what is this? We have vertebral column, no? If you section it, you will find within the vertebral column there is spinal cord. And if you take a cross section of spinal cord, you will get this. The H-shaped area within the spinal cord are gray matter. They look gray because these cells are non-myelinated. These cells are not having any myelin sheet. They are white because the neurons present there are myelinated. What happens? This way the section, no? So we have $12 segment here. 8 segments, 8 segments and 12 thoracic. 8, 12. In spinal cord, there you will get 8 segments. And actually, you won't get any segment there, any demarcation there in the spinal cord. Actually, we demarcate it according to the vertebral column ring. Suppose C7. So the area of spinal cord that remain within C7, it is also called C7. Spinal cord, C7 spinal cord. Okay. So suppose this is a section from T12, thoracic, then lumbar, then sacral 5 and 1 coccyx. So these are the different segments, hypothetical segments of spinal cord. So we know the sensations. Suppose I pinched here. So this sensation will be coming, I could sense. And how this information came? So from here, the nerve entered into the spinal cord. Entered into the spinal cord. And this nerve entered into the spinal cord through this route. This route is the posterior column. Through this route. Now here, it may form a synapse. And then its action may travel to the brain. Through these nerves, from here, actually, I am getting the sensation. If you cut it, you will not be able to sense because the pathway is broken. Through accident, if T1 and T2 is injured, suppose, maybe more. So what will happen? The sensation will come up to this, then there is blockage. So thereafter it cannot travel. So I lose my sensation. What is happening? At the lower side of the body, from this level, I will not be able to sense. Similarly, when this sensation is coming to brain, the brain will decide what to do. What to do? The brain will decide. So you do one thing, you go away from here. Better, otherwise you will be beaten. You go away fast. So the motor impulse from cerebral cortex will be coming downward. So coming through the downward, not by this path. There, this area. These are white matter. Dorsal column, anterior column, lateral column. These are lateral column. This is anterior column, posterior column of descending nerves. Of descending means motor nerves. And with the help of this, some will go to my hand to fight, or some will go to their leg muscles to run away. Okay, so they will be contracting the muscles. So these are motor sensations. My question is there, why I am discussing it? These nerves which are going to, sending impulse to the brain, sending sensation to the brain, these nerves are myelinated. And their myelin sheet is removing because of deficiency of vitamin B12. That's why those who suffer neurosis, we ask them, you take these vitamins, vitamin B2, B6 and B12. These are the food, nutrients for the nerve cells. Okay? So when there is demyelination, so you will feel tingling sensation, and since numbness, you cannot carry this sensation to your brain. It also affects central nervous system. Same phenomenon. Initially there will be, it's one of the important, if you find a diabetic patient, remember this, diabetes affects target is 3 organs. Diabetes, when there is diabetes, it will affect 3 organs. Its target organ is 3. One target organ, eye. Another target organ, heart. So when there is diabetes, number of diabetic patients rising like anything throughout the world. And it is a disease of, we invite this disease. It is not coming from outside. It is called lifestyle disease. Because of our lifestyle, we acquired this disease. You will not be doing any physical exercise, uncontrolled eating habit. You will be taking alcohol. You will be smoking. Sir, what is the role of smoking to this? Smoking affects all the organs, all the tissues of our body. No cells, no tissues are spared. So it will be affecting all my body tissues. So diabetes, that's why we call it, because it's a lifestyle disease. By improving, modifying our lifestyle, since from your age, you can avoid it, you can manage it, you can avoid it. And what are the other symptoms? Fatigue. Anybody? Weakness, fatigue. Can anybody explain the physiology? Why I should feel fatigue? Surya from South Indian. Surya is the hero of which area? Surya? Karnataka? Tamil? Tamil hero. I like it. Jabardast.
Sir, I am not explaining it. I feel fatigue. I think I am diabetic.
How do you feel?
Sir, I get symptoms that blood is not coagulating.
That is different. This is not the symptom of diabetes. Then you might have Tripura, bleeding disease. This is a bleeding disorder. Clotting disorder. Delayed bleeding means you are having some problem in accumulation of platelets. Delayed accumulation. Everywhere you will be bringing diabetes. Why do you feel fatigued? Why do we feel? Very simple answer actually. Very simple answer. Yes, he will answer. Very good. Sit. Good. There is anemia, no? Anemia, no? Anemia means what? You will be anoxic. You will feel anorexia. Means lack of oxygen in your tissues. Lack of oxygen means lack of oxidation of food. Lack of oxidation of food means lack of generation of ATP. So if there is not ATP formation, how you will contract your muscle? You will be unable to walk. Unable to, there will be apathy. You will not be concentrating on anything in studies. Always you feel sleepy. Weakness. Okay? So this is the simple answer. Now it is clear? Okay. What are the other points which needs physiological explanation? Weight loss. Cause of weight loss? Anybody can explain? সব আমি বলবো everything I have to explain, no? You will not be helping me. Simple. Very simple. First of all, you have lost appetite. If there is no appetite, whatever I bring for you, you will not feel like eating. But this is delicious for, hey, give me, I will eat. But for you, no, you don't like. So you will be consuming less food. Okay. Forcibly, I entered something. So it went to stomach. My stomach says there is lack of hydrochloric acid, lack of pepsin. How can I digest it? How can I digest? So there will be discomfort and you will skip dinner also. So there is also diarrhea. Whatever the amount is passing from stomach to intestine, these are not getting time for absorption. Very busy. When this food entered in intestine, they are very busy. When to come out? Because of rapid movement of my intestine, peristalsis is increased. Just opposite that of constipation. There is less movement. And not constipation is because of other thing, I will tell. And so there will be rapid formation of loose stool. You will be losing water, lot of water from your body. So you may feel dehydration. There may be dehydration. There may be hypovolemia. What is this? Very common term. Volume of blood, volume of tissue fluid has decreased. So this is the cause of weight loss. Now who will tell? Hey, you. So next to Sardar. He will explain why there is loss of weight. Yeah, very energetic boy. Lot of energy. They are now serious. Sir, otherwise, if I can't, unable to answer, sir, how he is reacting, it's not good for in presence of all others. So they are cautious now. So we could learn a lot about pernicious anemia. Okay? So I think you will not forget. For exam purpose or any other purpose, you will remember this. If you have any question regarding this, yes, sure, you can ask. Or else I'll discuss another thing, another important aspect, not related to pernicious anemia. Below 18.5 is underweight. More than 24.9, less than 30, 20.9 is overweight, and more than 30 is obese. Obese is further classified obese 1, obese 2. So this way you can classify elders. Now, suppose you have identified some persons, you are going to adopt now some family. So I think each of you should have to adopt 5 families, and it is your responsibility to look after them. What are the diseases they are suffering, and if they suffer, you have to take care. Means you have to take them to the clinic for their treatment purpose. You will not be able to know, but you can monitor them. You can advise them. You can do it. You do it. If necessary, you can send them to hospital for admission, if situation arises like that. So this is your duty, to monitor the family. They may be suffering from a lot of things. Your duty is to minimize their sufferings. You have to look for the social, the demography of the village. Demography means there are so many things. First, what is their religion? What is their caste? Some villages are there, these are ST dominated area. Some villages are there which is SC dominated areas. You know that. So you see the demography, what kind of people are staying, whether they are Hindu, whether they are Muslim or they are Christian, because this religion, caste, it impacts everything, their socio-economic conditions. Now their socio-economic conditions, how you can assess? First of all, you have to study their education. What is their education? What is the education of the head of the family? What is the education of the, at present situation, who is the head of the family? Father or mother? Father? Mother? Officially it's mother only. Okay. So, what is their education? Now, what is their occupation? What is their occupation? Some villages, they are only doing physical activity, means they are performing maybe agriculture, they are engaged in agriculture, or some are, most of them are daily laborer, or some are, they may be engaged in different professions. So what are their professions? What are their occupations? Occupation of the mother. If mother is engaged in service, say she is working in this hospital, and so who is there? Husband is also going, but they are having 2 kids. What will happen to these 2 kids? Deprived of care, deprived of proper fooding, in time fooding they will not be getting. So there is a chance of suffering from malnourishment. So you have to link with that. And they are earning, father is earning a lot, mother is also earning a lot by doing their services. So in that case, what they will do? They will keep some maid, caretaker. they will take care of that. In that case, that when earning is more, their purchase ability is more. So they are able to provide more food to the members of the family. So they will not suffer any malnutrition. But suffers. Some of you are also suffering malnourishment. Some are undernourished. I can see some undernourished students. And some are overnourished. All are so they are malnourished. And how will you understand? The some is overnourished by their weight. Their BMI is more. And they are doing less physical activity. That's why they are obese. They are accumulating a lot of adipose tissue. Okay? So they are malnourished. And do you know why? Poor people cannot be obese. Is it possible? Poor people? Only the rich can become obese. Who will eat the food from restaurant? Who will eat the fast food? So that's why they will suffer. So you have to study the malnourishment in the family, in the village. Whether the prevalence of malnourishment, what is the prevalence of malnourishment in the family? Suppose all of you together have studied 100 children, 100 preschool students whose age is up to 5. And among them, you found that 25 children are suffering from malnourishment. They are undernourished. So you can see, now you can compare. This is the rural area. Now you compare it with the urban value. Is it more or less? Definitely it will be more. Now what are the reasons of this undernourishment that you have to analyze? What are the reasons of this undernourishment? The reasons are, maybe the parents are poorly educated. They don't know what are the nutritious food, whose food they should consume. They are only eating carbohydrate-rich food. They are eating less. Is it only bhat, rice, aloo, potato. So only there is guidelines. Try to understand these guidelines. For all of you, those who are health concerned, your calorie intake, daily calorie intake, how much? If you are moderately active or sedentary, if you are not doing any physical activity, you are coming by car, going to by car, and not doing any regular physical exercise, so you are sedentary in habit. How much? 4,000? 2,000. Sedentary?
Kilocalorie?
Sedentary?
No, moderate.
For sedentary personnel, one modification came. Actually, these are regulated in India. What you should do, how much you should eat. These guidelines comes from NIN, Hyderabad. NIN means NIN, National Institute of Nutrition. It works in collaboration with ICMR, Indian Council of Medical Research. So they are actually advising how much calorie you should take, how much protein you should take, how much fat, how much iron. These dietary recommendations are made by them. We call this dietary recommendations as RDA, recommended dietary allowance. Okay? So for adult, they made this recommendation based on sex. Based on sex, because this will vary according to sex. Based on age, what is your age? Based on your mainly physical activity. So considering these three things, they have recommended separate RDA for girls. Again, the girls are divided into sedentary, moderate, heavy activity, lactating mother, pregnant mother. Requirements are different. So accordingly, they have advised what are the nutrients, how much nutrients you should take. Now I'll tell about yours recommendation. This is about, suppose for easy calculation, suppose it is 2000 kilocalorie. And this energy, this calorie will be contributed by three nutrients, three major nutrients, macronutrients. What are these? Carbs, carbohydrates, and protein, and fats. What about vitamins, minerals, water? They will not provide any energy. Only these three are their energy giving nutrients. So one is protein, another is carb, another is fat. They will contribute. 1 gram of protein can provide 1 gram of protein. When it is utilized in my body, they can provide us 4 kilocalorie of energy. Per gram. And is also 4 kilocalorie per gram. And this 9 kilocalorie. Okay? Now you see, I will determine how much protein you should take. On an average, you have to take 1 gram protein per kg of your body weight, irrespective of your sex. Then if your body weight is 50 kilo, what is your body weight? This card, yeah? 50. Okay. Then if it is 50, then how much protein she should get? She should eat 50 gram. If you are 70 kilo, 70 gram. So if you eat 70 gram of protein daily, then how much energy will come from this 70 gram? 70 into 4? 280 kilocalorie. So out of 2000 calorie, 280 calorie will be coming from protein. Next is carbohydrate. 65% of total calorie. On an average, 65%. How much it comes? 65% of total calorie? Calculate. 1300. Huh? 1300. So from here, I am getting from carb 1300. and fat. Not more than 30 gram per day. Never. If you want to avoid future cardiovascular diseases, if you want to avoid your cholesterol level reduction, if you want, then you have to take this. If you don't want my triglyceride level should rise, then you have to take less than, better 25 to 1 spoon of oil, 1 spoon of butter, ghee, means 5 gram. Means 5 into 9, 45 kilo. Every spoon, 45 kilocalorie. Now you think, how much fat you will take? Okay? 1 spoon of sugar, 5 gram, means 20 gram of energy, 20 kilocalorie of energy. So this is for your estimation, how much you are eating. You are eating 1 rasgulla, 10-15 gram minimum. So for you it's not okay, it's okay. But for us, baps. So this will increase my blood sugar level by at least 4-5%. Okay. Then, how much it came? 1300 plus 280. Total. The rest of the amount should come from 2000 minus 1580. 420. Calories should come from fat. Divided by 9, how much it comes? How much? 4? 44? 40? Suppose 45. So 45 gram of fat, oil. Fats and oils you have to eat. But it is recommended not more than 30. Then how you will take? From protein and from carbohydrate. The poor persons, poor family, the villagers, they actually eat 75 to 85% of total calorie from, roughly 80% of total calorie from carbohydrates. So that's why they are deficient in protein, deficient in fat. And lastly, I'll finish by one thing, the problem of obesity. What's wrong? Only thing, I look awkward. My dresses are difficult to get, size. Okay, I don't bother. I don't bother. But those who bothers, they suffer psychologically. Always there will be some inferiority complex. People are obese and motu. This sort of a dialogue is to come. So this is creating problem. One thing, psychologically. Forget about the psychology. And physiologically, what can happen? If it is the girls, adult girls, they may face reproductive problems, particularly in their MC, menstrual cycle. There will be irregularity, not only irregularity, a lot of other problems. And in some cases, they may suffer infertility. So you should be cautious about your body weight. And importantly, in the long, your liver may become fatty. When you perform, ultrasonography will be performing on your abdomen. If the report will come, hepatic stenosis or fatty liver, grade 1, grade 2, grade 3. Grade 3 means severe. All the fat cells, adipocytes, all the adipocytes are to perform so many functions, but maximum position is taken by the fat. So your reading room is occupied by unwanted material. So your space for reading, sleeping is less. So gradually this space is minimizing. So your hepatic activity is minimizing. And at one stage, there will be breakage of the adipocytes. And lot of enzymes will be coming from these into the blood. And there will be increased levels of enzymes, hepatic enzymes, like SGPT, SGOT, alkaline phosphate, these are the things. When it is advised, liver function test, blood test, liver function, you will find these values. And because of, and it means when this level rises, this means your hepatocytes, liver cells are damaging. So you don't want to, liver cannot be replaced. Your kidney can be replaced. Okay? But liver also can be partly removed. Those who are having, what is the cirrhosis of liver? Liver shrinks. Removed by liver cells are removed by the fibrotic cells. They are non-functional. So liver will not produce all these proteins, plasma proteins. So they will suffer low osmotic pressure. So because low osmotic pressure means there will be edema, there will be cirrhosis, what is this called? Accumulation of fluid in the peritoneal cavity, ascites. So a lot of consequences, there will be bleeding problem because these factors cannot be synthesized in the liver. So a lot of problems will come. Okay, so we want to avoid fatty liver. So to avoid fatty liver, we have to reduce our body weight if it is more. Moreover, fat accumulation not only in adipose tissue, there will be accumulation in the wall of the inner wall of the blood vessel, means atherosclerosis. Blood vessel lumen will be narrowed, so your blood pressure will increase. And one time there may be formation of atherosclerosis and you may suffer either stroke or heart disease. So you have to avoid this. These are the major things. So a lot of complications are there with obesity.